is Spencer. I'm going to be your nurse today. Would you mind telling me your name and date of birth?
Zachary Allen, January 25th, 1997.
Okay, perfect. So today I'm going to do a head-to-toe assessment, if that's okay with you.
Yeah.
Okay, so since you're able to tell me your name and date of birth, I know you're oriented to self. Can you tell me what day of the week it is?
Wednesday.
Can you tell me where you are?
The hospital.
Okay, and can you tell me why we're here?
I'm getting a head-to-toe assessment.
Okay, perfect. Just by your overall appearance, I can tell everything looks normal, which is a good sign. And since you're able to answer my questions, it tells me that your speech is intact. So I'm going to take your vital signs. So the first thing I'm going to do is I'm going to check your pulse and your respirations. Okay, your pulse is 62 and your respirations are at 14, which is normal. Alright, so now I'm going to take your blood pressure. Alright, your blood pressure is 125/90. I'm going to stick this pulse ox on your finger. While I do that, I'm going to take your temperature. Okay, under your tongue. Okay, 97.3, which is normal. And it looks like your pulse ox reads at 99%, which is great. Okay, so all your vital signs look good. Next thing I'm going to do is I'm going to do a neurologic exam. So could you pull on my fingers for me? Okay, now can you straighten your feet out? Okay, can you push on my hands? Okay, can you pull on my hands? Good. Alright, I'm going to look in your eyes now. I'm going to look in each eye a total of twice, so 4 times total, okay? Alright, ready? Okay, good. Your pupils are equal, round, and reactive to light. Now, could you look at my finger? Okay, now look at the wall. Okay, good. Accommodation is good. Have you had any kind of headache, dizziness, nausea, or vomiting? Okay, good. Now we're going to move on to your respiratory. So, have you had any kind of respiratory symptoms like coughing, any kind of mucus, shortness of breath?
No.
Okay. I'm going to listen to your lungs. Okay, so every time I move my stethoscope, if you could take a deep breath for me.
Sorry about the sneeze.
Okay, I'm gonna give you a second to just breathe normally. Your breath sounds good on the back, and I can tell by your breathing that your breathing is normal. You have normal chest expansion. I meant to ask you, have you had any kind of difficulty swallowing?
No.
No? Okay. So, based on everything I did neurologically, it seems that all of your cranial nerves are intact, which is good. Okay. So I'm going to listen to your lungs on the front. Okay. Again, every time I move my stethoscope, if you'll just take a deep breath for me. Okay, good. That all sounds great. So we're going to move on to your heart. So first thing I'm going to do is I'm going to put this back on. And I'm going to listen to your heart rate and feel your pulse at the same time to see if they are equal. Okay. Those are equal, which is good. And the next thing I'm going to do is listen to, actually, I'm not going to do that. I'm going to compare your heart rate on both sides. Sorry. Okay, good. Your pulse is equal on both sides with an amplitude of 2, which is normal. Now I'm going to listen to your heart. Okay, everything sounds normal. Have you had any kind of cardiac problems like palpitations, dizziness, anything like that?
No.
No? Okay. So now I'm going to check your hands for their temperature, for any kind of edemas, and then your capillary refill rate, which is about a second, which is normal. I'm going to go ahead and check your arms for the temperature as well, along with edema in your arms, mobility, and turgor. Okay, everything looks good. You look nice and hydrated. Okay, now I'm going to do the same thing on your toes. Can you swing your other leg up there? Okay, good. Now I'm going to check for edemas. Good. Check the temperature of your legs if that's okay. Check for edema again. Okay, good. temperature is equal, which is a good sign. Now I'm going to check your pulse on your dorsalis head, your DP pulse. Okay, those are both equal with an amplitude of 2, which is good. Now I'm going to check your PT. Those are both equal with amplitude of 2. Now I've looked at your skin, you don't have any lesions that I can see. Do you have any kind of IVs, incisions, wounds, or catheters I need to look at?
No.
If you're a high-risk patient, usually I would check your bony prominences, like your elbow, your lower back area, and your heels for any kind of redness or ulcers. But since you're not a high-risk patient, I won't do that today. Okay. So now I'm going to take a look at your abdomen. Contour looks good. It's nice and normal. Have you had any kind of pain in your abdomen?
No.
No. When was the last time you had a bowel movement?
Today.
I'm going to listen to your bowels now. Alright, your bowel sounds are active, which is normal. That's a good sign. And now I'm going to palpate your abdomen. You said you had no pain, correct? Are you ticklish?
No.
Okay. So I'm just going to touch lightly. Okay, good. Everything seems normal. There's no kind of lumps or hernias or anything like that, which is good. To move on, the next thing I want to ask you is, have you had any pain using the restroom?
No.
Have you had any kind of like a sense of urgency or any hesitancy to use the restroom?
No.
Okay. Sometimes at this point, if I had a urine sample, I would check it for color and its clarity. I don't have a urine sample today, so you don't need to do that. Okay, so the last part of this assessment, if you'll just sit up and swing your legs around. You can just stand up and walk like 7 steps for me. Okay, good. You can turn around and walk back. Perfect. Alright, well, you can go ahead and lay back down. Okay. Do you have any questions?
No.
Are you comfortable?
Yep.
Okay, here's your call light. I'll make sure to let your doctor know and put all this in your chart. If you need me, just feel free to call me, okay?
Alright.
Alright, thank you.